All right, ladies and gentlemen, I'm one day away from being a week after the procedure. And as you can see, I am standing upright here in the house. Of course, it takes an effort, but I am walking. I do have the walker with me just to make sure that I still have my balance, but I feel pretty strong, stronger than I felt before the surgery with my foot. My wife is sitting here and just remarked about the fact that my one calf looks a little smaller than the other, and I think that's from months of just leaning more to the left and using my left leg more than my right, so there's some atrophy there. But anyway, there is some pain, but I don't have that pain that I had shooting down my leg all the time or into my foot. I am kind of slowly but surely weaning myself off of the pain medication. It calls for me to take oxycodone every 4 hours. And what I've been doing is I'm taking 2 of those in the morning, which is a total of 10 milligrams, and then 5 throughout the day at the 4-hour interval and at night, just to kind of help me sleep. If I feel it's necessary, I'll take the full 10 or I won't take any at all. The best thing that I found has been the muscle relaxer. That's been pretty significant because as my body is healing and as your body is going to heal, you're going to find that your muscles tend to tense up around the area of the incision. And of course, if you had any bone removal around those areas as well. So that makes it harder for you to stand or to walk for long periods of time. And we just kind of have to slowly but surely stretch through that. But the muscle relaxer really helps make a difference in that regard. The other, as I mentioned in the last video a couple days ago, is just nerve medicine. The nerve medicine has been helpful. They do both make me drowsy. Again, you'll be on a restriction for driving. I can't drive for 6 weeks, which means I'll be working out of my house when I return to work. I can't sit for long periods. I can't stand for long periods. So that also means that, work is going to be somewhat limited, regardless if you have a light duty job or not. I sent some pictures, for example, to my family yesterday of my wife and kids on the way out the door. And a couple hours later, my wife replied and said, "Our heads are cut off." Well, when I took the picture and I sent the picture, it looked perfectly fine. I go back to look at it and yeah, their heads were cut off in the picture. So that's a subsequent result of just the medication and not being 100% with it all the time. But this process it's been challenging. Again, we're not even a full week yet, but I am in a better position than before this got started. So, I'll continue to post videos as things come up. Have great friends, a good doctor friend of mine dropped by yesterday. I've had several babysitters that have come by just to help me grab things and to sit with me and to eat with me. And of course, my wife has been super great. She's planning out the week, putting food out, doing all kinds of stuff. So, thank you to all my friends if you happen to stumble across this video. But again, if you're thinking about having this type of back surgery, which is extremely conservative relative to putting in a cage or a fusion or anything like this, I would strongly suggest this is where you start. As one doctor told me, putting in the hardware is where a lot of people experience the pains and the setbacks and the side effects. This procedure, where you're just removing bone to alleviate pressure in certain areas, is supposed to be a much more conservative and effective way. So this is where you may want to start. And again, I did everything but acupuncture. I mean, we did injections, we did chiropractic care, we did physical therapy. Nothing seemed to work. But this so far seems to be giving us the results that we want. So, yep, I'm walking. A couple days later, I was trying to show you the walker. I'm standing to record this 4-minute video now, and I don't have the pain that I used to have. So hopefully this is helpful to you. Again, I appreciate all the people that had videos that they posted. And if you have any questions, put them in the chat. I'm happy to answer them. Take care.